We're dealing with COVID patients every single day that I'm at work, basically since early October, September.
And so we have a COVID unit, a COVID wing on both floors. And so, yes, every day we can have maybe, somewhere between or 15 or 20 COVID patients at a time on our service. And it's all different levels of acuity. Some people go home quickly and some people stay a long time.
Jack Lowney is an RN in the ICU, and Eric Larson, chief hospitalist. They say they've gotten used to caring for COVID patients at this point, but they'll also tell you that doesn't diminish the anxiety of constantly walking into a situation where you could potentially become exposed.
I'm immunocompromised. I have Crohn's disease, and so I'm on immunosuppression, and that puts a little bit of more anxiety in the situation.
I have a young family and wife at home, and that was my biggest concern, what I would put them at risk for and bring home to them.
Stressful, yes, but that's just a part of the job sometimes.
We do what we do, so I've been jumping in and gowning up and getting in there every single day.
Luckily for Lowney, Larson, and other frontline workers, Community Medical Center received its first shipment of vaccines earlier this month. For many, it was the sigh of relief they'd waited months for.
When I first got the news and the email that I could sign up and go get my dose, it's just this incredible sense of relief.
Not only has a weight been lifted, but what better way to prove their support of a vaccine than to get it themselves?
The best way to do anything is to lead by example, and I'm a huge advocate for vaccines and seeing what this virus has done to our community and to our patient population and our hospital systems. It was the biggest step in the right direction.
With a vaccine circulating through Missoula's hospitals, an end to the pandemic is finally in sight. Now, it'll be up to the general public to do their part.
When it comes down to it, there is no good reason not to get this vaccine. It protects you, it protects your family, it protects your loved ones. Even if you're somebody who is not a high-risk person for COVID, I guarantee you that you love somebody who is.
In Missoula, Megan Mannering, MTN News.